Hi folks, this is Ali Nassa, and I wanted to share with you some of my experiences with the newly released KontrolFlex file by Brasler USA. Now this is a very unique file with specific characteristics that you need to understand before you can use it. So let's get into it. Before we get into the specific uses of this file, I just wanted to kind of share a little bit of history with you so you can understand the metallurgy involved here in order to understand the way this file behaves. Now, historically, the first NiTi files that became available on the market were all Austenitic. Now, Austenitic files, austenite and martensite, are two specific phases of the nickel-titanium metal. So nickel-titanium is an alloy, and austenite and martensite are two crystalline structures of the same metal. Now what happens is a little bit of heat treatment can change this crystalline structure, and interestingly enough, based on whatever crystalline structure these files have, they have different characteristics. So what I'm trying to say is that austenitic files, for example, they have greater cutting efficiency. They have edge fidelity, which means that the edge is very sharp and it stays sharp. It doesn't roll over because the metal is pretty hard. Although it's super elastic, it still has a lot of torque resistance, and what that means is that the file doesn't quite unwind. If an austenitic file unwinds, you got to throw it out right away because it means that file has really reached its capacity for torque. Now, on the other hand, austenitic files have low cyclic fatigue resistance. So a lot of bending back and forth can create fatigue, and they can break as a result of that. So they're a little bit less flexible because of that. On the other hand, martensitic files, which is the other kind of a phase transition of the specific NiTi metal alloy, have a high cyclic fatigue resistance, and therefore they're very flexible. So these files are actually fairly malleable, which means that you can almost pre-curve your NiTi file, which is a really great niche use in specific cases. At the same time, however, because of what you gain in terms of this flexibility, you end up losing something, and that is your torque resistance. So your NiTi files that are martensitic are going to unwind very quite readily and much easier than your austenitic files. So as a result of this, some manufacturers have tried to play around with this metallurgy to produce files with a mix of austenitic and martensitic characteristics. And these files were originally theorized that they would be the best of both worlds. Unfortunately, we all know that there's no such thing as the best of both worlds, and you can only be mediocre in each world as a result of that. So before we talk about these types of files, let's take a quick look at this thing that I call a phase transition spectrum diagram. And what that is if you look from the left to the right, you have austenitic file, which are a little bit cooler side of this transition for the metal. And then when you heat treat these metals, the same nickel titanium alloy, it achieves a martensitic deformation and a martensitic crystalline structure. The difference, as I mentioned before, is on the left side, your austenitic files that were the original files that came on the market. Those were super elastic, but they were hard. They returned back to their shape, but then they were at the same time they were torque resistant, and they had very efficient cutting capability, sharp edges. On the right side of the spectrum, your martensitic files, you could pre-bend them because they were flexible and ductile. At the same time, they were very cyclic fatigue resistant, but had very low torque resistance. So if you look at the list here, your original files on the left side, your EndoSequence, ESX, KontrolFlex, ProTaper, Vortex, all Profile, GT files, all those files that originally came out back in the 90s, and then also in the 2000s, were all austenitic files, and they were really nice and sharp, and they had a good torque resistance. But then somehow along the way, some manufacturers decided to kind of play around with the metallurgy to heat up the metal a little bit and get some kind of in between, and those became known as, the first one was your Vortex Blue file, and then later on your Edge file, and then also all the gold series in the Tulsa Dentsply files. And those were trying to have a little bit of martensitic kind of components to them as well. Well, this file, the KontrolFlex by Brasler, is really quite a Martensitic file. So it's the KontrolFlex Martensitic M, and this file can actually quite easily be pre-bent, and it's very, very flexible. It's super flexible, very resistant to cyclic fatigue. But the downside of that is that you will get a little bit unwinding a little bit more readily. But it's okay because you can autoclave it. You put it back in the autoclave, and it rewinds back right away. And that is really an advantage in that sense. So you can get the super flexibility. You just have to understand that you will get a little bit unwinding, and unwinding on this side of the spectrum isn't the bad news that it used to be on the left side of the spectrum. On the left side of the spectrum, as soon as you get unwinding, you have to throw that file out. On the right side, if you get unwinding, it's okay as long as you keep control and measure your working length, and you make sure that it stays the same, and you keep remeasuring it on your ruler, then the fact that the file unwinds is not a problem. So there is something else that comes up as a result of this. It's something that I have found to be very useful, is that when you end up having this situation in which you have files that are completely austenitic and completely martensitic, instead of having this idea to come up with files that are in the middle of the spectrum, so there would be an average of austenitic and martensitic, which as I said, they hope to get the best of both worlds, but they may actually end up getting not quite the best of both worlds, but be mediocre at each world. Maybe if we hybridized a couple of files from the left side of the spectrum and a couple of files from the right side of the spectrum in the same sequence for a given advanced case, then you could actually end up getting the best of both worlds by actually combining each world into one. So what am I trying to say in this? Before I confuse you anymore, let's take a look at it. For example, I'm talking about maybe combining some endosequence and ESX files with the KontrolFlex M or KontrolFlex Martensitic file, and this kind of a sequence will help you in the straighter portion of the canal to use the ESX and endosequence, which is more torque resistant and therefore it won't unwind. And then as you get to the apical 1/3 to 1/2 of the root, you switch to the KontrolFlex Martensitic files, and now all of a sudden you have removed and enlarged in a crown down fashion the top part of the root with a austenitic file. So very efficiently and quickly you remove the top, and then for the bottom 1/3 where the curves and the dangerous anatomy is, now you're using a Martensitic file, which will have may have a little bit of a lesser efficient cutting, but has a lot more flexibility. So this way you actually are trying to achieve truly the best of both worlds by applying each file with its own specific characteristics in that part of the canal where it will excel. So austenitic files in the coronal 2/3 of the root, Martensitic files in the apical 1/3 to 1/2 of the root. So let's take another look at it. So if you also look at it in terms of basic, advanced, and super advanced or advanced squared cases, as I call them, that you run into, you will find out that most of the time austenitic files will certainly be adequate in using your basic, to take care of your basic cases and most of your advanced cases. But somewhere between advanced and advanced squared cases is where you're going to end up needing this kind of a hybridized sequence of both austenitic and martensitic files. And that's where this type of a combination comes handy. So KontrolFlex is fully martensitic, and therefore it has great flexibility and cyclic fatigue resistance, and it's indicated really in advanced and super advanced cases that require instrumentation around curvatures and very difficult type of anatomy. And during these cases, the file will unwind, as I mentioned before, but it's okay because it will rewind once you autoclave the file. Heating the file will basically revert it back to its original shape. So it's a little bit of a magic trick, but it actually works. So a way to avoid getting this type of a unwinding in these files is to use them in a single stroke and clean technique, which is SSC, which I have described in the past, and you can visit us on our website, everyworldendo.com. So you can get a little bit more information about this specific technique that utilizes the specific brush which your assistant will put a little alcohol on and wipe the flutes of your file clean and after each stroke. So it's a very efficient way of cleaning the debris out of your file flutes and therefore reducing the torque on your file. So this is a good way of reducing the torque on the file and reducing your unwinding. Now that can also happen. You should do this SSC also with your austenitic files, but it's specifically and far more important with your martensitic files. So let's keep in mind then, therefore, that the three main uses of these Martensitic types of files, including the KontrolFlex M, is for advanced cases and super advanced cases with difficult anatomy. Also in difficult to access areas. When you have patients that can only open this wide, getting even a 21 millimeter file down into the back of the tooth to put it in the lower second molar's mesial roots are pretty tough. So one of the beauty of these types of Martensitic files is that you can bend them so that they can actually have an easier access, and you can work them around the same way when you pre-curve your files. You're able to put them in the mesial root of your lower molars a lot easier because you can basically come in with an angle, and I will show you a little video that demonstrates that in a second. And the third main use is also bypassing ledges, and in that it's quite helpful because we all know that we can bypass ledges easily using hand files. However, NiTi files in the past that have been austenitic, they stay straight, and it's very difficult to get around a ledge with a straight file that is fairly stiff as well. So being able to create a tiny little hook, a J hook, at the end of these files is certainly very helpful in allowing us to bypass these ledges. So let's take a look at the first case here, which is this lower molar that this patient has very difficult access, and we have a tough time getting in. And here's the KontrolFlex orifice opener. As you can see, I'm putting, just with a little bit of an alcohol gauze, a good curve here on it, and that allows me to easily slide the file in by coming in at an angle. You can see here it's fairly curved, and it allows me to be able to see actually just the tip of the file and put it into the orifice and go in there. And as you can see, it straightens out after it rotates, and it's because these files again are quite malleable, and they get that kind of a that just the rotation in the canal will straighten it out. You can see here too the same thing with your working files. That was the orifice opener, and by the way, the orifice opener is really a great file that you end up using pretty much in all your cases that are in the back where you have difficulty in accessing. You can see here that easily, just using the back of the handle of my mirror, I was able to pre-curve the size 35 KontrolFlex file and then put it into the canal again. Now it's important. See, I'm just pre-curving it again. Look at that, and that allows very easy insertion of the file into the canal. That's important to know that you need to, unlike the other files that was rotating when you go into the canal and out of the canal, here with these files you have to stop the file after you wipe it before you put it in the canal, because otherwise it'll wobble because it's not going to be in a straight shape. Here I'm applying the BC sealer to the canal, and once again I'm using a pre-curved KontrolFlex file just to push the sealer down here. Again, just demonstrating other uses with this ability to pre-curve your NiTi file that allows your master file to be pre-curved and push the sealer to coat the canal walls completely. And here I'm just using the BC cones with the biceramic sealer, using hydraulic condensation, using bonded obturation here to then bond my gutta percha cone with the help of BC sealer into the canal. And that's basically in that cases. Then you can see we had a little bit of a sharp hook at the apex of the mesial roots that the files handled beautifully. In this case went by very quickly and efficiently, was completed with the KontrolFlex file using a pre-curved type of a help to get access in this back area of the mouth. Now let's take another look for bypassing ledges. As I mentioned, bypassing ledges, this tooth was previously started by the patient's dentist, and there was a ledge that was created that they couldn't bypass, and the patient was referred to me right here on the mesiobuccal root. You can see there is a ledge present. This file is not fully seating when it's straight, and it's going down because it's hitting that point of the ledge that has been created with an austenitic file in a curved root. So what I do, just you could take your cotton pliers and create a nice little hook, a J hook, and I put the J hook again. The file is not rotating when I put it in the canal. You keep it completely off, and then you place the tip of the file in the canal. You go down to the point of the ledge, then you quickly throttle in, and it'll find the area of the ledge and it'll jump in. So the ledge is bypassed this way. At this point, now you want to just go up and down in short amplitudes of 1 or 2 millimeters for a good 5-6 times while it's rotating, and it helps blend in a path into the canal again. and I'm doing that again. You can pre-curve in whatever direction is comfortable for you, and then rotate the file until you find the proper path to get into that area of the ledge. So here the ledge is towards the mesial buckle, and I'm able to basically pre-curve it in a way that's easier for me to pre-curve, but then turn the handpiece on and let it rotate until it faces the direction that I want, then put it in the canal. So I've actually cleaned this case all the way to the end and fit the cones, and then place the bioceramic sealer again the same way as before, BC sealer. I'm injecting directly. In this case, this is the advanced obturation technique. Remember that the advanced obturation technique is used for those who have a microscope and you can see what you're doing. Otherwise, you would be using the basic, in which you just place the sealer on a paper pad, and you can take your pre-curved master file here and then just kind of coat it and then push it all the way down. That would be a good way of coating the canal walls. And then you coat your master cones and slowly seat them to full working length. This way you can put additional cones when you have oval canals that will fill up that space. There's no need for lateral or vertical condensation. Just sear it off at the orifice level and about 1 millimeter above it, so you can melt that gutta percha above the orifice, and then use a number 10 plugger to push it all the way down. And here's the final fill. You can see that we bypassed that curvature. There's 4 canals in here, and the ledge was bypassed easily, and the canal was filled all the way to the end. So the KontrolFlex files come in a variety of sizes. You have the orifice opener that I mentioned, which is size 1907. This is a really nice orifice opener to use in almost all your cases. Again, it will unwind on you a little bit, but don't worry. Once you put it in the autoclave, it'll rewind again. You can get multiple uses out of the orifice opener. I probably use mine for 5-6 times before I toss it. Also, the other files, in the system, the main files come in sizes 15 through 45 in the 04 taper, and these files could be used again on their own with their own sequence, so they could be hybridized in the technique. So they could be hybridized with either end of sequence area SX in a sequence of sizes 40 through 35, followed by sizes 30 through 20 in a KontrolFlex in a crown down manner in a very advanced cases, or you could use basically 40 or 35 KontrolFlex A, which is the Austenitic version of KontrolFlex, and then 30 through 20 in KontrolFlex M, which is the Martensitic version. And now you end up having sizes 40 through 20 in a hybridized version of Austenitic in the straight portion of the canal, and Martensitic in the apical portion of the canal, where you need to have that kind of curvature management. So you are using them in a crown down fashion from the largest to the smallest. So the 40 and the 35 prepare the top part of the canal. By the time you reach the middle part of the canal, then you just switch to the M version with the 30 through 20. So let's talk about some of the basic type of cases you run into in a clinical practice. Your basic, advanced, and the advanced square type of cases that include this type of anatomy. As you can see in the lower, on a basic case is a case where you have a single canal and it's a fairly straightforward type of a straight case. On advanced cases are cases, for example, molars, where you have at least one of the canals are kind of thin and narrow and maybe a little bit curved. And of course, advanced squared cases are cases where you have severe curvatures and calcifications, and those kinds of cases are more difficult to handle. Now, in the past, all manufacturers have been giving you is one universal sequence that they recommend to use with all cases. But we all know that everyone's practice composition is different, so you all have different types of cases you run into. It doesn't make any sense to use the same sequence on every case, because in some cases you're going to end up using way too many files, and in some other cases you're not going to use enough files. When you have a universal, that's kind of like trying to be the best of both worlds. This is what ends up happening, is that you're not going to be good at any one individual case. As specialists, our job is to customize treatment for the individual case you're dealing with, and this is where this kind of triaging of your cases is very important and helpful in terms of deciding what is the right sequence for a given case that you're dealing with. So, for example, I'm just going to write it down here. You always need to have some hand filing. That sizes, small sizes of 8, 10, and 15 hand file are still necessary. That's just the safest way of doing your instrumentation, to have some hand filing, helping stainless steel create some kind of path, and then having your night eyes finish it up. In basic cases, as what I have described in the ESX protocol, it's very easy. You really end up needing, for the most part, only 2 files, an expediter and a final file to finish that case. For advanced cases, you always need to have an orifice opener, and then there's a couple of scout files that you're going to end up using, and then you will get to a finishing file that would be your final finishing file. Of course, I'm not going to bother with explaining the basic and the advanced in this issue because I don't want to confuse people. There's ample videos and explanations on our website for the basic and the advanced protocol, so I would recommend that you go onto our website and take a look at that. And then for the advanced squared, however, as I mentioned, you can use 40, 35, and then 30 through 20, or you could use this other sequence that I recommend, which is using an orifice opener. You always need a little bit of an orifice opener at the beginning. It always helps reduce the load on the actual files you're going to use inside the canal. So an orifice opener, and then use a scout file, which I'm using the ESX scout, which is a 1504, and then followed by sizes 35, 04 ESX, or it could be any other constant taper file, and then 30 through 20, 30 through 20 in the 04 constant taper, also with the Martensitic KontrolFlex file. So here we're hybridizing the first, besides the orifice opener, the first couple of files, the first couple of files are Austenitic, and then the last 3 files are Martensitic. And this combination allows you to kind of get these cases done in a very predictable manner. And you can see here that that's basically completed using these protocols that I mentioned. So this is basically the bottom line here. Once again, I'm just showing the specific sequence that I'm using for the basic, advanced, and advanced squared type of cases that requires hybridization a little bit on the advanced squared side. So to sum things up, KontrolFlex has a place in your repertoire of files. It's a Martensitic file that can be successfully hybridized with the Austenitic files in order to address some of the tougher or the super tough cases that you run into. Of course, they can also be used in a sequence on their own in a crown down fashion, but expect them to unwind a little bit when you're doing that at a higher rate than your Austenitic files. But again, as I mentioned before, that's okay because they will rewind back after you autoclave them, and the unwinding on the Martensitic side of the spectrum isn't as scary and as dangerous as unwinding is on the Austenitic side of files. So that's not really a concern, the fact that they unwind. If I were to use them on a full sequence of KontrolFlex, the files will unwind on me, but I just basically ignore it. I just make sure I have the right lengths, and I make the measurements, and I will proceed to do the case. Of course, using SSC will help reduce the rate of unwinding, that single stroke and clean technique. So please our website, rebuildinno.com, where we're going to have more tutorials and videos in this particular area. And any questions that you have, you can ask us in the Ask the Faculty questions section of our website as well. For Rebuildinno, I'm Ali Nasseh, and I hope you found this information helpful.